Sometimes sexually transmitted diseases or STDs don't show any signs. However, very often symptoms occur in the infected person. In this video, we're talking about the most common STD symptoms individuals should be aware of and on the lookout for. So now we're going to cover the most common sexually transmitted diseases and what the warning signs look like for each. Number 1, human papillomavirus or HPV. Very frequently, people with HPV don't show any symptoms. Sometimes both men and women will develop genital warts. Women may get an abnormal result from a pap smear test. While this isn't very common, some cases of HPV can develop into cancer, including cervical cancer. In fact, according to the Centers for Disease Control and Prevention, 90% of cervical cancer cases are caused by HPV. Note that even if an infected individual shows no symptoms, they can still spread HPV to their partners. All it takes is skin-to-skin contact, not necessarily penetrative sexual intercourse. This is one reason why it's important to get regular screenings, especially if you have multiple sex partners or engage in risky sexual behavior. The HPV vaccine exists and is given as early as age 9 years to protect against the most dangerous HPV strains that can cause cancer later in life. Number 2, syphilis. Frequently, the signs of syphilis appear after around 21 days post-infection, although this number can vary, according to the Centers for Disease Control and Prevention. In the first stage, the infected person might notice a genital sore, typically painless. The sore could go away even without treatment, but the individual remains infected. In the second stage of this sexually transmitted disease, the individual may notice red, rough rashes all over the body. During this time, other symptoms can include fever, sore throat, headaches, weight loss, muscle aches, fatigue, and swollen lymph nodes. Without treatment, syphilis will remain in the body even though there are no signs or symptoms. The latest stage of untreated syphilis can even damage the brain and eyes. Number 3, herpes simplex virus. In this case, symptoms can depend on the herpes simplex virus type. For example, oral herpes, which is associated with herpes simplex virus type 1, is often marked by blisters and open sores in and around the mouth. Symptoms of genital herpes associated with herpes simplex virus type 2 often include ulcers, blisters, and bumps on the genitals, inner thighs, or even around the anus. Note that oral herpes can turn into genital herpes and vice versa through oral sex. Commonly, these types of sores are painful and can break open, ooze, and then crust over again. Number 4, hepatitis. Many people have hepatitis and don't even know it. The symptoms do occur with an acute infection. They can pop up at any point from around 2 weeks to 6 months after exposure. These warning signs include fever, a loss of appetite, vomiting, nausea, fatigue, joint pain, jaundice, dark urine, and abdominal pain. For chronic viral hepatitis, symptoms can take decades to develop. All 3 types of hepatitis, A, B, and C, can potentially be spread through sexual activity, depending on sexual practices and preferences. Number 5, trichomoniasis. Trichomoniasis is caused by a parasite. Women might experience vaginal discharge, itching, and painful urination. If the infected person is pregnant, it can increase their risk of delivering the baby prematurely. Infected men don't normally experience any symptoms, but should still get tested, especially if they have multiple sexual partners or think they might have engaged with an infected partner. Number 6, gonorrhea. Gonorrhea infects the mucous membranes of the reproductive tract, which includes the fallopian tubes, uterus, and cervix in women, and the urethra in women and men. It can also target the mucous membranes of the eyes, throat, and mouth. Warning signs of gonorrhea can include discharge, a burning sensation when urinating, sores, and rashes. Number 7, chlamydia. Chlamydia is sometimes called a silent STD because most people won't show any signs of it. Because it moves relatively slowly in the body, if symptoms occur, it might take several weeks after infection. For women, the bacteria can reach the cervix and cause symptoms of cervicitis. From there, it can spread to the upper reproductive tract, like the uterus, and cause PID or pelvic inflammatory disease, which can be severe enough to cause an ER visit. The urethra can also become infected and cause urethritis. Men with chlamydia often have urethritis, and some develop epididymitis, which can be quite painful. Both men and women can also experience conjunctivitis and infection of the rectum. Number 8, human immunodeficiency virus, or HIV. There are different stages of HIV infection. During the primary infection stage, also called acute HIV symptoms include fever, headache, rashes, diarrhea, weight loss, coughing, night sweats, swollen lymph nodes, sore throat, painful sores, muscle aches, and joint pain. This can be deceiving because in these early stages, they almost appear to be flu-like symptoms. During clinical latent infection, many people don't experience symptoms or complications. This stage can last for years if the individual isn't receiving treatment. During symptomatic HIV infection, long-term symptoms and mild infections may arise. These can include fever, fatigue, thrush, and shingles. If individuals don't seek HIV treatment, it can progress to AIDS within 10 years. Thankfully, HIV medicines and antiviral treatments have saved many lives. So, what to do about sexually transmitted infections? Prevention is the best cure. To avoid sexually transmitted infections, individuals should use condoms for sexual activity, including anal sex and vaginal sex. While condoms don't guarantee that the individual won't acquire an infection, they greatly reduce the likelihood compared to having unprotected sex. Second, sexually active individuals should talk to their healthcare provider about getting vaccinated. Several vaccinations are available to protect us against these diseases. Third, communication is key. People engaging in physical intimacy should always be open and honest with all sexual partners so that both parties can better look after their sexual health. Last, but certainly not least, STD testing is an absolute must. Individuals should get tested if they're engaging in any sort of intimate contact, even if they're not sexually active and having intercourse. Any sort of sexual contact, including skin-to-skin contact and oral sex, is enough to spread a sexually transmitted infection. Remember that STD symptoms vary between different infections and different individuals. A healthcare provider can offer more specific suggestions for keeping their patients happy and healthy.